Welcome to the National Black Nurses Association's Real Talk, calling all nurses COVID-19 vaccine confidence and acceptance webinar. This is the second webinar in our Real Talk series. I am Dr. Millicent Gorham, Executive Director of the National Black Nurses Association. I bring you greetings from Dr. Martha A. Dawson, the NBNA 13th National President, the NBNA Board of Directors, and staff. I am excited to co-partner this webinar with blackdoctor.org, and NBNA is most grateful for the support of Johnson & Johnson. Lean in and get ready for a robust discussion on COVID-19 acceptance and confidence. The goal of the webinar is to educate and encourage nurses to get vaccinated and to give them the tools to encourage their families, friends, and other colleagues to get vaccinated. Join me in welcoming Dr. Linda Washington Brown. Dr. Washington Brown is the vaccine program coordinator at the Miami Rescue Mission Clinic. She's the immediate past president of the Miami chapter of the National Black Nurses Association. She's the chair of the NBNA Diversity and Inclusivity Committee. She's a former member of the Health and Human Services Vaccine Panel, co-chair of the AAN, American Academy of Nurse Practitioner, Equity and Diversity Special Interest Group, and co-chair of AANP's Nomination Council. We will be joined shortly by Dr. Donald Alcendor of Meharry Medical College. Welcome, Dr. Linda Brown.
Thank you so much, Millicent. It's a pleasure to be here and to be with the audience on this evening.
Thank you so much. At his press conference on yesterday, President Biden exclaimed over exceeding the goal of 100 million shots in arms and now wants to double that effort to 2 million. Dr. Washington Brown, what would you tell your nurse colleagues that would help to build their confidence around the COVID-19 vaccination?
Well, the first thing that I would say to them is that we have to remember that we are the leaders and they have trust in us as one of the most trusted professions. So one of the things that we really want to hone in on is that we should lead by example. And we all know that vaccines, preventable diseases have not gone away. So COVID is just one number among many. Therefore, if we want to see our nation stay healthy and safe, our loved ones, our families, our communities, then we want to not only have the vaccine on board for ourselves, but also to encourage others.
So can you briefly explain the different vaccines and the differences between them?
Yes. Currently, we have two messenger RNA synthetic vaccines, and that was produced by Pfizer and Moderna. And of course, as you know, Pfizer was out of the gate first, followed by Moderna. And then we have the Johnson & Johnson and the AstraZeneca, which are vector type vaccines, meaning that usually there's only one dose. What are the differences? Well, with the messenger RNA, they are encoded or enclosed with a lipid nanoparticle, meaning it's like a little fat particle that allows entry into the cell, but not into the nucleus or the DNA. So there is no change. There is no problems with your DNA being recoded because you're receiving a vaccine that goes into the cell. The whole purpose behind that is so that it masks itself from our own body's antibodies in order to enter and to mount the type of antibody response that we need to ward off the COVID vaccine. The difference in the AstraZeneca, the Johnson & Johnson with the vector type vaccines is that those are usually one dose. These are weakened or attenuated vaccines that are now used as we had in the past. So if you wanted to get one dose of polio, if you were to get the actual oral inactivated or weakened, that's a one dose shot, because then it's like giving them the weakened form or the killed form. And I have to stress that because some people say, oh, you're giving me the virus. No, you're giving a weakened form. And in fact, they are actually using what we call the adenovirus that they have actually cloned and weakened to mount an immune response within our own bodies to protect us in the event that that COVID vaccine, a COVID virus itself, actually tries to attack our bodies. So again, how they both work is that once your body creates the antibodies, the memory cells against these viruses, then once the body recognizes it, and then it mounts a defense and it goes to work to stop it from binding to whatever those binding sites are within our bodies to keep us or to protect us from getting the virus itself.
So we've heard about the emergency use. We've heard about obviously the clinical trials, and now we're moving, I guess, towards full use. So are the vaccine clinical studies finished?
Absolutely not. We have phase 1, 2, 3, and we are currently in phase 4. Phase 4 means that now the multitude of the whole country has the opportunity to participate in this study. An emergency use authorization only means that we are still in an experimental stage. And so the more numbers that we have that are vaccinated, the better we can have a good look at what the effects of the vaccine, the efficacy of the vaccine, as well as any adverse effects that may occur, because we're dealing now with a larger cohort or a larger population that's involved.
Talk to us about side effects.
There are side effects to all medications, let's say biologics, and I think that would clear the air here. Vaccines are biologics, just like Tylenol and any of the medications that you or I may consume for specific reasons. And therefore, each of these biologics or medications or vaccines come with certain warnings. And in those warnings, it will tell you these are some of the side effects that had occurred when we were actually going through the earlier phases of these particular biologics, right? So it may cause swelling. And I'll give you an example, a calcium channel blocker, for example. Many times when people take those for their blood pressure, they may have pedal edema. That's a side effect. And then there are other types of side effects where you may get a headache, you may have nausea, you may have even a rash. So when these vaccines were studied among those large groups of people that were in the actual experimental group, those that received the vaccine, not those that received what we call a placebo, meaning it was either a sterile water or a sterile saline that they received, what you see now is what happens when it goes into the body. So for some people, they had body aches. For others, they may have felt very weak. For others, they may have had a loss of taste or a loss of smell. For others, they may have had general body aches. And I could go down the line with the different types of responses that different people may have had. But interesting enough, those that receive what we refer to as a placebo, they have also experienced some of those same things. So how we determine whether this is something that we need to warn the public about is that when the experimental group, the group that actually received the vaccine, showed higher rates of these different types of responses, then we say to the public, these are some of the things that you may or may not experience. Now, I tell people all over, if someone step on your toe, you're going to feel pain. If someone sticks you in the arm with a needle, you are going to feel pain. And once that medication is absorbed into the muscle tissue, then you're going to feel some soreness, a little tenderness. You may even experience some redness. But guess what? That abates. It goes away. If it's the sore arm and the redness and that kind of pain, it usually goes away within one day. But some of the other side effects that have been identified, like tiredness, fatigue, weakness, those things, loss of smell, it may take 2 or 3 days. There have been some side effects that may have taken a week. Nonetheless, what happens is that those particular responses do fade or they go away. And we are still watching because remember, that was only a small number considered the population of what, 300 million people. So now that we are vaccinating this country, we are going to see more and more reports of different types of responses. And that's all that they are. They are responses to something that is not generally found within our bodies. And I hope that was a clear explanation for our public audience.
It was pretty clear for me. I did get my 2 doses, and the first one was just fine. Little bit of injection at pain at the injection site, but that lasted all of maybe 24, 48 hours. But the second one was a little bit different, and there was a lot of fatigue, but it only lasted 36 hours. Okay. And so when I was over, I can almost literally tell you at 1 o'clock, 36 hours later, I was like, oh, it's over.
Gone.
I'm not tired. I'm not fatigued, severely fatigued. So it does happen, but you do get through it.
Yes.
So is there anyone that should not get the vaccine? Should women get vaccinated if they're pregnant, breastfeeding, or want to become pregnant?
Okay, first of all, pregnant women, lactating women, infants, babies, and we know they were not part of that study.
Yes. And
so because we had not gone into what we call this phase 4, where we're now exposing it to more and more people, the word coming from the Obstetrics Society is telling many women that it is okay. My advice would be you must consult with your obstetrician, your gynecologist, your primary care physician before you embark upon taking the vaccine. However, lately, we are now getting new statements from the CDC saying that it is okay to take the vaccine. And as you know, we are also embarking upon different age groups as well. So as the study continues, this experimental study on how to keep us alive is continuing, we are finding out that this vaccine is actually safe for more and more groups of people, such as pregnant and lactating mothers. And we are also finding out now that we can actually, hopefully once it's approved, fully approved, that we would be able to give it to younger groups of people. So again, as you asked earlier, we're still in phase 4. The experimental stuff is still continuing. But at the end of the day, the most important thing that we want to take home from us with this discussion is that vaccine saves lives. And based on the 500,000 people here in America who have died from COVID, including my own first cousin on New Year's Day that didn't have that opportunity for the vaccine, I encourage all of us who are able to take the vaccine. And Millicent, may I just add, because you asked who was not able, there are people who have had severe allergic reactions to other entities, not just vaccines. And so we know that these people are not good candidates because of their hypersensitive nature of their own body's response. Then, of course, we're going to say to you, please get cleared by your primary before you even consider taking the vaccine, because it can also trigger some of your hypersensitive responses within your own body, which could be more detrimental to you.
Great. Then, Dr. Washington Brown, how do you respond to someone who says they've already had the COVID-19 virus and they ask you, do I need the vaccine? What do you say to them?
I would certainly tell them yes. And let me explain to the audience why I would say yes. Number one, the earliest studies showed that those persons that were actually exposed to COVID-19, their antibody response somehow lingered in what we call immune globulin M. Immune globulin M is usually one of the first, along with some of the other macrophages and things in our body, that will respond, or your T helper cells that respond whenever a foreign substance enters our body. What we found in the research or in the literature is that instead of you moving from what we call immune globulin M, which usually gives you what we call a initial response, which is not so great, it goes back to baseline, meaning that it did not retain adequate numbers of memory cells that if you were to be reinfected, that it would remember you. And so therefore you would actually get COVID again. So what we found is that it's better and safer to get the vaccine, because now you are more than adequately ensured that you will have what we call a antibody switching, meaning you switch from IgM to IgG, which is immune globulin G, and it does not go to baseline. And there is that, and I'm going to use my hands to kind of show you, there's a difference. Let me see in front of my camera. There's a difference in the spacing, meaning that that difference in spacing are memory cells. What we are trying to do, which could help us, and we're not sure yet, avoid a second dose of next year, a booster, I should say a booster dose of the COVID-19, is that we have adequate amounts of IgG, memory cells, that if we ever see COVID again, then our body's immune system, those antibodies, quickly go into action, block those binding sites, and therefore you cannot contract that particular disease. So again, those persons who have contracted COVID, we don't know exactly what your antibody count is, and that is referred to as a titer. So if we don't know what your titers are and how healthy a titer level you have, that means you can get it again. So by taking the vaccine, this boosts your immune system and gives you the added protection that you really need, that your body may not have gotten for you with your initial encounter with COVID.
Thank you very much, Dr. Linda Washington Brown. We're now being joined by Dr. Donald Alcendor. Good evening.
Good evening.
Good to see you.
It's good to see you as well.
Thank you so much. Dr. Donald Alcendor is the Associate Professor at the Center for AIDS, Health Disparities Research, Division of Microbiology and Immunology, Physiology, and Obstetrics and Gynecology at Meharry Medical College. He is a former special government employee at the Food and Drug Administration Center for Drug Evaluation and Research, better known as CDER, and a voting member of the FDA Antimicrobial Advisory Committee. Dr. Alcendor is an expert advisory panel member for the American Lung Association COVID-19 Action Initiative. Welcome, Dr. Alcendor, and you have the privilege of being on this call with me and Dr. Linda Washington Brown. Glad you could be with us.
Thank you so much for having me.
Absolutely. I'm going to go ahead and skip down to kind of where we left off with Dr. Washington Brown about misinformation. And Dr. Brown, I'm going to field this back to you, and then we'll pass it on to Dr. Alcendor.
Okay.
So talk about misinformation and debunking the myths in the Black community. I know you have been doing work in the homeless community. Talk to us a little bit what that means to them around the vaccine, getting the vaccine, and how, as a trusted member within their community, you've been able to help them.
Thank you so much for that question, Millicent. The first thing I want to say is that I think we talk about vaccine hesitancy quite a bit, and I'm not sure if everyone's clear on it, but vaccine hesitant really is described as a lack of confidence or trust in vaccine safety. So here's where the myth is. And I'm sure you've heard it, Dr. Alcendor's heard it, is that there was a rush to judgment in releasing this vaccine. And therefore, because what normally would take 5, 10, maybe 15 years for vaccines to be approved, it was done in the span of a year. So the first myth is that there were skips. We leaped over certain critical things that should have taken place to protect the public from any harmful effects of the vaccine. That indeed is a myth. And we know why we were able to do it in such record speed. I've also heard says, this is new and it is not 100% effective. And I said to many people, I said, well, the flu vaccine is not 100% effective either, but it's saving lives. And so those are the types of myths that we have to first dispel, that there was no missed steps in this process. What took place was a parallel activity. And that means the federal government threw their weight behind the production. They threw their weight behind the researchers, the scientists that were involved in the production, also with the distribution, and every step that needed to take place literally took place in record time. So if I had to speak to a myth, that would be the first one, that the vaccine production and distribution did not skip any important steps or stages. And the second is that they are still being scrutinized, monitored, watched, the watchdog groups. And a very good example is when Johnson & Johnson had, it appeared that these persons or these women that developed the clots, that it could have been associated with that vaccine. And so it was pulled, it was stopped. It tells you that you are not out there just getting a vaccine that has been given free reins. You are still being monitored. Any adverse events, we have VAERS, vaccine adverse event reporting system that should be reported, even if people don't report it. So we have watchdog groups, and I think that's the first thing. And that we as a healthcare community would never, and I know people say, oh, no way, because of, the Tuskegee study. But in today's world, we are all watching. And I think Dr. Alcendor can probably agree to that. And Dr. Alcendor, you want to add to that?
Yeah, 100%. I want to add to that. I'm just going to go back a little farther than you did in terms of myths. We have to go back to the idea that there was melanin in your skin that had a protected value to protect you from this disease, meaning that in the beginning, we didn't see many African Americans come down with this disease in the beginning of the epidemic. However, this concept of melanin in your skin having some type of a protective value to protect you from infection was one of the first myths. And so we go on to other types of myths. One that I think was very important is that people believe that the Trump administration had their thumb on the scale when it comes to approving this particular vaccine or these vaccines. What they didn't understand is that in order for any drug to be approved by the FDA, it goes through very strict regulatory scrutiny. And so when we think about vaccines in general have been safe and effective for decades. Vaccines are one of the most highly scrutinized public health medical interventions that we have. And I want to say that vaccines, in part, have allowed us to live 30 years longer than we did 100 years ago. And so this idea that a vaccine is approved willy-nilly is something that's completely ridiculous. A vaccine, once it goes through the phase 3 clinical trial, that information is given to a data safety monitoring board that is a body that is not associated with the government. And the data safety monitoring board scrutinizes that data, and then a recommendation is made to the FDA advisory board that I had the privilege of sitting on. And of course, these FDA advisory board members will review the data, all of the clinical data, and then make a recommendation to the FDA. And of course, the recommendation given by the FDA advisory board usually is followed by the FDA. Once the FDA approves this for emergency use authorization, in this case, it goes on to the CDC vaccine boards as well. And of course, at that point, the vaccine is then looked at for distribution and any kind of issues that are associated with giving it to folks. But again, I should say that emergency use authorization is not full authorization. So to date, there is no vaccine that has been approved in the United States for full authorization. So there are many more myths about the vaccine, particularly what's in the vaccine. And so many people think that there's mystery products in the vaccine that will actually allow you to follow them around and report to immigration officers where your location, meaning that the vaccine would contain some type of GPS chip in it that will allow you to track people from here to there. The other thing is that the vaccine would cause you to die 1 year after you take it. And so this is a big problem. And of course, the vaccine contains live virus. So none of the vaccines contain live virus. Moderna and Pfizer are RNA vaccines that basically represent a RNA cassette that is wrapped in a lipid nanoparticle, and then it's delivered to a person. That RNA is around for about 20 minutes between getting in your body and being translated. The RNA does not go to the nucleus and cause you to have mutations that can lead to cancer. So, Dr. Gorman, I can go on and on with these myths because there are just so many of them. And of course, one of the biggest ones, particularly in the Latinx community, is that somehow these researchers have been using aborted fetuses to develop this vaccine. And so you're getting babies, parts of babies being injected into your body as a vaccine.
Wow, that's a lot of myths to debunk, isn't it? Dr. Alcendor, you mentioned to me some time ago about your work in going into barbershops in your area. So would you like to talk to us about what you've heard and how, more importantly, how you have responded?
Yeah, I tell you, I get a lot of differences in opinions about this vaccine. And of course, I go into barbershops, beauty salons, and small businesses in Nashville. And I bring the message of just being a vaccine ambassador, and of course, a health and wellness ambassador for Black people. And the idea is that I want to give them the information they need for them to make an educated choice about accepting or not accepting the vaccine. I am not trying to push this vaccine down anybody's throat. I want them to have the information. I want to answer their questions associated with this vaccine and allow them to make a choice. And again, it's all on them. But what I hear from the people, it's very mixed. I'll go into a barbershop and they'll stop me at the door and tell me, what are you coming in here with this poison to kill our people? And so I usually don't get that response. And again, I just say, okay, I will leave you my information. You can look it over and you can reach out to us if you feel that you need to. But again, I go into a beauty salon and it's very different. There's a woman that I'm talking to and she's almost in tears. And she's telling me about her friend whose grandson somehow acquired this infection and brought it to the grandmother that lived upstairs who did not survive COVID-19 disease. And so I think what I'm hearing when I go and ask them, for those individuals that say, I want that vaccine as soon as it's available, these are people that oftentimes have a very serious problem associated with COVID-19 disease that have taken the life of a loved one and basically have made them more serious about getting this vaccine because they just don't want this to happen in their own family. And so again, I go into Latinx communities and I meet people that are basically saying to me, Dios, which is translated in English as God, God doesn't believe in this vaccine. I'm going to be all right because God will take care of me. And so, and they're saying this in Spanish, but I understand what they're talking about. And so I get different things everywhere I go. Even among professionals, they're telling me they want to know what's in this vaccine. They want to know what are the side effects using these vaccines. And they want to know the possibility of these variants not protecting them when they get these vaccines.
So let me ask the both of you, what is the government doing to ensure equity in vaccine distribution and increase access to the vaccines?
You want me to start, Dr.
Yeah,
Alcendor?
go ahead. Go ahead. I'll follow.
Okay. Well, initially, as you know, there was a rollout phase. And we all know pretty much that there were the frontline workers, boots on the ground, mostly hospital workers and long-term care facilities. Following that, then, essential, let's say the essential workers. And I think that's the term that was properly used. Following that, then, were your frontline people. And these are people, I tell them that you can't do your work from home. And I hope I'm not mixing the two up, because it was essential, frontline, long-term care facilities. So they were the first in the rollout. Also the military. And as you said, Millicent, I was actually on the vaccine panel with Operation Warp Speed. And so we pretty much had a clear understanding of how this was going to take place. So the military was given its own allotment. I'm blessed to have a military person in my family, and they immediately received their vaccines, hands down. And that did not have anything to do with initial distribution as we were trying to roll it out and make sure there was adequate supplies to get to the different states and then down into the municipalities. Following that, as you know, with the new administration that has come in, there has been an increase in the production, not only an increase in the production, but we have more of the vaccines that have been approved. So this gives us a larger quantity, a supply quantity from which to pull from. Now, distribution routes. The first one was coming from the federal government to the states. And then the states had the opportunity then to distribute it among their state workers or their state health departments and how they were going to distribute it. The other distribution came directly from the federal government, where it went to the retail pharmacies. And those retail pharmacies at that time were scheduled to make sure the long-term care facilities were adequately provided with the vaccines. So where are we today? Well, today we actually have a large distribution where we are now going into the heart of the matter. So now we are seeing an increase, in fact, at the clinic. As you said, I work with the homeless. We started out with 200 of the Moderna. Now we're up to 600. We literally, within the last month, just got them. We put it in January, but we're just getting it. And not only are we getting it, but other small clinics and the pharmaceuticals, retail pharmaceutical places, it's now out there. When we started, there were only 2 hospitals in South Florida that got those vaccines. That was it. So now we are able to see it. And with the new, it just started on May 4th. President Biden is putting out a call for grants where they want to see mobile units. They want to see vaccine distribution sites within these underserved communities in large quantities and making it available to those underserved groups that can't make an appointment, so to speak. He wants it where they can actually walk in now and get their vaccines. So things are changing, and they're changing in a positive direction for where we are going. Now, I can only speak for what I know is happening in my local area, but this is a federal initiative. So I'm going to think, and Dr. Alcendor, you can tell me what's happening in Tennessee and some other places. But the point is that the federal government now has a major rollout of it, not only increasing the number of vaccine availabilities throughout, but reaching out in whatever way is necessary with longer hours, operation hours, walk-in clinics, mobile. Let's get to the heart of the matter, to those people who need these vaccines the most. Dr. Alcendor?
Yes. So I agree wholeheartedly with Dr. Brown said, everything. What I think is this, is that access was a problem for a little while. It's not a problem right now. You're basically dealing with attitudes and trying to persuade people to accept this vaccine. We need high vaccine acceptance to make all of this work in terms of what we're trying to accomplish. And so The idea is that when we did at Meharry, we became proactive in terms of making vaccine access affordable to all the people in our neighborhoods and the surrounding areas. So we started assessment sites in Nashville. We had 4 different assessment sites. And again, anybody could come and be screened for COVID-19. At the same time, we also had places where they could get vaccines. You could come on campus, and Vanderbilt had access to vaccines. Nobody was charged. We also had the Krogers, the CVS pharmacies, and Walgreens all participated in giving people vaccine. We didn't want a situation where you had pharmacy deserts or basically a distribution of vaccines that nobody could get to. Then you have those individuals that are shut-ins. These are people that can't get to a vaccine because they physically are unable. And the idea is that what Dr. Brown said is that the idea of meeting people where they are to give them this vaccine, you might have to meet them in their kitchen to give them that vaccine. You see what I'm saying? But you have to plan to do that. You have to have the resources allotted to give a person a vaccine in their sick bed. You see what I'm saying? Because more than likely, a person in a sick bed has comorbidities that would put them at higher risk for this disease. And so vaccine access, I'm going to go off on something nobody's talking about, and that is global inequity of vaccine. And the idea is that we have to look at this in a very serious way, because vaccinating the United States will not cure this disease away from our shores. We know that the UK variant came here, didn't come here on a boat more than likely. That was a person that came with that infection and spread it to a contact, and you had a spike happening. So the South African variant, the same way. And so what I'm saying is that when rich countries that represent 17% of the world population are sitting on 60% of the vaccine supply, that has to change. We have to do this in the same way we did this for smallpox and polio. We have to have we are a global community. We have to have an international global campaign to deal with this virus and its variants. And so the idea is that when you look at a country like Canada with 38 million citizens, and they're sitting on more than 100 million doses of vaccine, that has to be made right. And the idea here is that they are getting together now to give excess doses of this vaccine. The World Health Organization is working with other groups to make sure that countries that are resource poor have access to vaccines. You have people that are packaging vaccines in South Africa, and they can't put that same vaccine they're packaging in their arms. This is ridiculous. We have to change this. So we have to look at ourselves through the developing world when it comes to disease, particularly this disease that travels very easily, very contagious, and can cause problems that may be for years to come. And so we have to look at this as a global effort to sit down with the World Health Organization, bring all of our global communities together, develop a strategy that would allow us to deal with this virus now and not later. And again, getting the kinds of numbers of people we need to be vaccinated is so very important. These variants will not stop. And the idea is that in the United States, if we have pockets of people that are not going to take this vaccine, we will have continual transmission, virus replication that leads to the evolution of variants, maybe a variant that can basically get through and deal with any kind of vaccine you might come up with. And so this is a concern. We have to get those people that are saying they're not going to get this vaccine. And of course, what I'm seeing today with children getting ready to receive this vaccine from Pfizer, that is from 12 to 15 years old, I think this is good. And of course, Pfizer may be coming in September for people younger than that. I think this is a good thing. And again, it adds to the numbers of people that will be in the vaccinated fold very soon.
Well, I want to thank you both for responding to that question. I want to give a shout out to the National Black Nurses Association because we have chapters that have been out on the front lines giving shots in arms. So I want to give a shout out at least to the Birmingham Black Nurses Association, the Black Nurses Association of Miami, and the San Diego Black Nurses Association for all that they're doing. I know Dr. Linda Washington Brown is a part of the Miami chapter, so I want to make sure we give a shout out because our 108 chapters in 34 states are doing a yeoman's job in making sure that they're educating each other about the vaccinations and educating the communities where they work, live, play, and worship. I have a couple of questions in the chat before I jump on to some more that I have that I want to ask you. So one of the questions in the chat is, what is preventing the FDA from giving the vaccine full authorization and not just the emergency use authorization?
Dr. Alcendor, I'm going to start out and you're going to finish.
Sure,
right?
No problem.
and we know what it is. As before you came on, Dr. Alcendor, I was just saying to Millicent and to the audience that we're actually in phase 4. This is where we have the larger group, the larger numbers. We had a special group, our experimental and our what do you call it, placebo groups that we work with, but that could not fully replicate the large masses here in the United States. Now that we've rolled out this vaccine to millions of people, now we can truly see what the effects are. We already used the example of Johnson & Johnson. So as we roll out phase 4, we're moving through phase 4 in this experimental vaccine, we will be able to see just what the problems are, wherever they are, and what types of people they will impact. So this experiment is still ongoing. And once the number, the quota, the effect size, I should say, is better satisfied, I'm sure there will be a revisit back to the FDA, and then they will look at all of the data. And one of the things that Dr. Alcendor says that they even have a group that does nothing but collect the data and have to piece through all the data that's being collected to determine, what is real and what is not real and what do we need to consider. So that's where we are. And until that takes place, to my knowledge, we will still be in that emergency use authorization stage, which is experimental. And at some point they are going to call it, but not just yet. So Dr. Alcendor?
Yeah, so I agree with Dr. Brown in every way here. And again, let's think about the time it takes to make a vaccine, the vaccines that we've had in the past. We're talking about 10 to 12 years to develop a vaccine from the discovery phase to the vaccine distribution and licensure of that vaccine. So the idea is that they have not had the time to fully evaluate this vaccine long term. And the idea, think about it, we have never seen a vaccine being developed and only providing the FDA with 3 months of data for them to make a decision on this vaccine. So the idea is that if you have a condition that might occur 1 in 100,000, when you start to add large numbers of people that are going to get this vaccine, this can be completely serious for quite a number of people. And so we have to be vigilant. We have to be careful. And I know we want to move quickly, but the idea is that whether we get full authorization or not, right now, if you're 16 and older, you can get this vaccine, whether it's fully approved or not. And I expect this vaccine, Pfizer's vaccine, to be approved shortly for people that are 16 to 85 years old. And so I think that will come. I think it will come certainly before September. I would think by the summer, before the summer ends, you probably see that happening. And again, this means a lot for the vaccine companies as well. When a vaccine is approved, now they have full licensure of their vaccine. Now it becomes a little more interesting as these vaccines start to cost too. It's something we don't talk about, but vaccines cost money. And in general, vaccines are very, very cheap. But these vaccines are a little bit innovative. They're different. We have never had an RNA vaccine make it into our toolbox when it comes to vaccines. And so in terms of who's going to pay for this going forward, if we need boosters, you can expect that insurances might be involved in paying for this, or possibly out-of-pocket expenses for these vaccines going forward. But again, it is about scrutiny, it's about being careful, and it's just simply being vigilant about knowing enough about this vaccine before they pull the trigger on full authorization.
So we've been talking a lot about the vaccines and the importance of the vaccines, but there is a question in the chat that says, what about natural treatments like sunlight, vitamin D, zinc, and elderberry? We've been hearing about how we need to keep our immune systems up to top condition. Talk to us about natural treatments.
You want me to go first, or you want to go first? And I follow you this time.
Sure.
Like, I do encourage all of us to eat right, have proper sun exposure, adequate fluid intake, exercise, do all the things that we know can be immune protective for us. And if it means increasing your vitamin D3, the zinc, and all of the other things that people use, the remedies that we feel will really protect us, I would never discourage you from that. But we are dealing with a virus. And I also tell people, because I heard Dr. Alcendor talk about the variants, viruses are doing what they do normally. They mutate. And so we can do all of the right things, but at the wrong moment, if our body, for whatever reason, tends to like slope, and that particular virus actually has a foothold, you can still get the disease. In spite of all the good things, the vitamin C, the vitamin D, the magnesium, we can go down the line. And so I encourage you to maintain that attitude of healthy lifestyles, healthy eating, fluid intake, proper sun exposure, all of the above. But I cannot say in all good consciousness that will prevent you or me from getting COVID if we are exposed to the degree where our antibody system is unable to stop that spread. Dr. Alcendor.
Yes, what I believe is this, is that if you're sitting there with underlying comorbidities for this virus, and you're saying to yourself, I'm going to rely on vitamin D to get me through this, I think that's a bad choice. I think what you have to do is, of course, take care of yourself. I think if you're sitting there with hypertension and diabetes, you need to manage those diseases. You need to be able to manage those diseases. And the idea is that being a molecular virologist by training, we are taught to understand that if you're going to make claim for something, you have to have a mechanistic understanding of that claim. And so when you think about vitamin D and all of the things like elderberry and all of that, from a scientific standpoint, we think about what is the mechanism by which these particular reagents will actually inhibit virus replication. At the cellular level, we would have to say that has to be proven for you to say that this would be something that would be useful as a tool in our toolbox to prevent COVID-19. And I would say you would take something like a $6 anti-inflammatory like dexamethasone, and now you've got something relatively cheap that's also approved by the FDA, and it is very good at reducing inflammation and reducing the cytokine storm associated with COVID-19. So you see, now we have something that is relatively cheap, approved by the FDA, and has been studied for many years to do something very important that would prevent you from having more severe disease. Now, those claims match claims you might have for vitamin D or elderberry or something like that. They probably don't. There's no clinical studies that would support how these reagents might inhibit a virus to prevent you from having more severe disease associated with this infection. And so what I would say is that studies need to be done. And of course, the idea of taking something word by mouth may not be the best way of doing things when it comes to a virus that is so devastating like this virus. And so the mortality associated with this virus is very high. It's very contagious. And the idea is to relegate yourself to taking something from Walmart off the shelf to protect you against this virus. Now, if it can increase your general health and wellness in terms of you are vitamin deficient in some way, I would say, yes, you need to pursue that. But sitting there, a person that is eating a balanced diet, taking a daily multiple vitamin, I would think that you would be going across the board in a lot of ways of taking things. And again, taking mega doses of some of these vitamins can be harmful to you as well. And so many people believe more is better. And so instead of 250 milligrams, I'm going to take 2,500 milligrams if I want to protect myself better. And then they can run into problems of basically some type of a problem associated with overdosing themselves for a particular vitamin. And so I would say that go and read about it, talk to your physician about it. And the idea is that you don't want to take vitamins you don't need to, particularly water-soluble vitamins that are there and then gone out the urine very quickly. And again, it's how you take vitamins as well that I think people should think about. So if you're taking fat-soluble vitamins like A, E, D, and K, you want to take those vitamins with food. You see what I'm saying? If you're taking water-soluble vitamins like vitamin C and vitamin B12, then you would want to take those vitamins on an empty stomach with a glass of water, because now you're going to absorb those vitamins better based upon their properties.
Well, thank you so much for that, particularly about those natural treatments and how we can boost our immune systems. But now it's time to get back to some sense of normalcy. Some sense of normalcy. So over the past weekend, as I was getting to a sense of normalcy, I decided early in the morning, around 11:30, I was going to meet a friend for an early brunch and went out to the lake, and we decided we would kind of social distance a little bit, have a little bit of brunch, and we watched all the people walk by with no masks, because we were told that as long as you're outside, you can walk around with no mask on. So what would you do? What would you recommend to our audience about getting back to some semblance of normalcy? I want to go back to choir rehearsal at the Metropolitan Baptist Church in Largo, Maryland. But is that something that we can get prepared for? Talk to us about that.
Okay, who wants to go first?
I'll go first, Dr. Brown.
Okay, and then I'll follow because I have comments on it.
So, Dr. Gorham, you didn't mention who's immunized or not in your scenario. And so that's important. So if a person's walking around without a mask, first of all, they should be immunized. And when I say immunized, I'm talking about a person that had either their one shot of Johnson & Johnson or their 2 shots of the Moderna or Pfizer, and 2 to 2.5 weeks after they've received those, they are considered to be fully immunized. And so now if you're fully immunized and your friend standing next to you is fully immunized, then you can walk hand in hand. Now, if you decide to stop over at that discotheque on your way, and it's a closed door event, there's very little circulation in there, and people are packed to the gills in that place of business, then now you should reach into your purse and pull out your mask, even though you've been vaccinated. I'm going to let Dr. Brown finish this.
Okay, and I also wanted to talk about viral transmission, because I think this is kind of where we're going. You're out in the open air. Can this virus be transmitted from someone as Dr. Alcendor said, we don't know their vaccination or their immunization status at this point. So they literally can have the virus, because it's from the time of positivity till the exact time of negativity, you can still transmit. So we don't know this. And unfortunately, as you know, I'm in South Florida, so the debate is on. Our governor's lifted everything, and you can just do it. But business and many of us in healthcare are being very cautious with this. And I always tell people, I wish that we had kept and had the same mindset with the flu, and maybe we wouldn't have seen so many cases. Because why? We were covering our mouths properly, or our noses. We were washing our hands. We were keeping our distance. We were doing proper engineering control, meaning if you're sick, stay home. quarantine yourself wherever you are. Don't, spread this, spread it around. And so the same thing would apply if you're out in the community, out in the open. And we've already seen the studies of the distances a sneeze or a cough or whatever can go if that person is actually transmitting or have the positive COVID virus. So there are the positivities and the negativities to this. For me personally, if I'm alone, I uncover if I'm outside. If I'm among people, I put on my mask. I have been fully vaccinated. I make sure I wash my hands and I continue to follow social distancing. Why? Because we have found that works. And so we are focusing on COVID because COVID we know kills. But there are a lot of other viruses out there that would make people very, very sick. And so if we continue to make sure we take the proper steps, in safeguarding not only ourselves, but those around us, I think that we are in a better shape, or in a better position, I should say, to hopefully combat this along with the vaccines.
Yeah. So Dr. Gorman, I want to add just a little touch to what Dr. Brown said. There is something called breakthrough infections. This is something you're going to hear a lot about. And I want you to be able to understand this in the context that it is. And that is, a breakthrough infection would be an infection that a person that is fully immunized gets. And to get a breakthrough infection, you have to be infected by another person after you're immunized. Now, the incidence of this is very low. In a study, they looked at 87 million people, and about 7,200 of them had breakthrough infections after being fully immunized. And so this is important. And the idea is that that's a 0.001%. You see what I'm saying? Very low, but it's still there. And it represents another reason why you should wear your mask when you're coming in contact with people whose immunization status is unknown.
So, ladies and gentlemen, I'm going to let Dr. Alcendor, that was the last word. I want to thank Dr. Donald Alcendor, Dr. Linda Washington Brown for this wonderful, robust conversation about COVID-19 and getting vaccinated. And I want to also thank our partner, blackdoctor.org. Again, I want to thank our sponsor, Johnson & Johnson, for funding this wonderful webinar. And the last word is, I want to invite everyone to the 50th anniversary celebration of the National Black Nurses Association, August the 3rd through the 8th. We will see you there. Thank you both so much, and everyone have a good evening.
Thank you.
Bye.
Bye.